for stability. I start by releasing suboccipitals. Okay, and there's a variety of different ways of doing these, but it's all going to, for me, it all involves ischemic pressure. Okay, so I've got to find them, press into them, and move around those top bands until I actually feel them release. Okay, then I'm able to get some length out of her spine that I wouldn't have gotten otherwise, and I'm going to do that with distraction. I don't use mechanical traction. That doesn't make it the devil's tool. It's just I don't like putting someone on those machines and walking away. I want to feel what's going on. So then I'm going to do some manual distraction, subtraction things. Okay? So let's do those two things. I'll show you what we do and try it out. Some of you have already done some of this stuff. Some of you have a loved one who can do it for you. I don't know. So the first thing I'm going to do is I'm going to start feeling around at the base of her skull. Okay? My landmarks I want to find is I want to find her spine. I want to find her cervical spine, which when she's laying down I can find because everything is relaxed, or relatively so. So I find her spine so I kind of know where middle is. I come up into the base of the skull. I find these bumpy bones behind your ear. What are they called? Mastoid. Mastoid processes, right? Bilaterally. Okay? And then I find the base of the skull. I work my way from mastoid processes towards the center. And I dive down into this wonderful cushion, this little mattress of muscle. Okay? And I can feel distinctly the separate muscles. I'm just posterior to sternocleidomastoid here. So I'm feeling rectus capitis posterior major and minor, and obliquus capitis superior and inferior, the suboccipital group. So I find the one or the ones that have the trigger points in them. The ones where it's just the muscle is so easy to find because it's just standing up at attention. Okay? And then I press. And I just hold it. And I'll usually press straight in like this and or press it up against the base of the skull, so I'm slightly distracting her cervical spine. Okay? Now, as massage therapists, I know you guys do 1,000 other things. They're probably much better than this, but this always works. So, for instance, I feel right there. I don't know if that's sore on you. On the right side, I feel rectus capitis posterior inferior right there, and it's just standing up, only on the right side. Okay? So I'm really pressing, and then I'm distracting. And I'm going to hold that for 2 or 3 minutes, which means that my hands need to have gone into training for this, right? Because you start to get tired. Then I move it around, just so you can see over on your side. I'm moving it around like this. I'll go along the length of the muscle. I'll go across the muscle, transversely, all the time maintaining a firm pressure until eventually I feel it release. And that usually happens in a couple, 3 minutes. Sometimes it'll happen sooner, and if it doesn't happen by 3 minutes, I stop. Because all I'm going to do is just make it happen. Okay? So I just maintain that with that slight distraction with my fingers. Okay? Back and forth along the muscle, along its length, always coming right back up to the base of the skull with some sustained pressure. Okay? So I do that. And then I relax it. I kind of feel around a little bit more. And see what it did, how it feels right now. I go back in, I kind of press up on those spinous processes a little bit like this, so I can see what the mobility of her cervical spine is like now. And then I'm going to say, you know what, now that those muscles are relaxed, at least for the time, I have to stretch them. One of the principles of managing trigger points and tight bands is that I don't care if you inject them, I don't care if you put a tennis ball in them, your elbow, your knee, a hunting knife. They're going to come back unless you stretch afterwards. Okay? So now that I've got that released, what I'm going to do is I'm going to take, I always like to use a gown just because it works fairly well for me. Okay? This one might be a little too thick, I don't know. Now if you raise up your head real quick, there we go, back down. Okay? Now, I always look to see what kind of earrings they wear. If they have posts on the back, sometimes this can be uncomfortable. You don't have to take them out now if you don't want to, but it's something you always pay attention to. If they've got, they can just slip them out, then you just take them out. Okay? Otherwise it digs in and it hurts them. So then all I'm going to do is this. Okay? And I don't want you to help me. So go turn off the lights. Can you do that? Because you're looking up into fluorescence. Great. I like that so much better. Already it's like, okay, feel calm. Right? And then I just have, most people, 99% of people will close their eyes. And I like that. weird when they don't. Okay? Because I got to kind of be looking around and seeing things, and I got really nice paintings on the wall at the other end of the table, in the rooms where I do these, because that's for me. It's not for them, so I can look at them and go, okay? They think it's for them, it's for me. So I get right up underneath the base of the skull like this, okay? And I just do this, okay? I just want you to, don't help me, just try and relax. You're just going to feel some pulling. And then all I do is I just lean back. See what's happening? I've captured the base of her skull, not her jaw, which is what I hate about those harnesses that we use in mechanical traction. And all I'm going to do is just going to lean back, and I'm just oscillating. I'm just rocking. And she's just breathing normally, and her eyes are closed, so she's not weirded out either. Right? And I'm just rocking back.
Try giving a massage to somebody who won't close their eyes and is not talking to you.
It's
And they follow you
It's
around.
creepy, and they're just staring at you the whole time. You're like, it's time for an eye pillow.
Okay, so try that with somebody that has bug eyes, doing that, and it's like,
It's pretty creepy.
It's uncomfortable. Quit staring
So
at me.
we encourage them, just relax, just close your eyes, and now I'm just going to do this. I'm going to probably do this for about, I'll do it for about a minute, and then what I do is I release. And then I'm going to rock back again. And I'm going to do this for about 3 or 4 minutes, just rocking back and forth like this. And there's music in the rooms that I have that's, New Age kind of stuff, Celtic music, things that I like, that most people go, that's kind of cool. I like that. It relaxes me. I can't tell you how many mommies